Hi guys, it is Tamara. Thank you so much for coming back to my channel. Welcome back. Today we're going to talk about bipolar spectrum disorder. This is a topic that I've gotten a lot of requests about. I have lots of videos on this channel about borderline personality, about psychopathic parents, about individuals who have grown up in traumatic households and how to manage that parent or how to identify that parent's problem. But in today's video, I want to talk about bipolar spectrum disorder, and I want to talk about some of the traumatic aspects of growing up with an individual who has this particular disorder. I'm going to highlight some facts, but I'm also going to highlight the emergence of unusual behaviors that they tend to have as a characteristic of them. And I do want to highlight before we get into this video that not all individuals with bipolar disorder have unusual behaviors, but there are some who do. And unfortunately, when they're a parent, they can sometimes create a traumatic childhood. So we're going to go ahead and jump in. Thank you so much for coming back to my channel. For those who are subscribed and participating, thank you so much. And for those who are new, I encourage you to go ahead and hit that subscribe button so you can stick around with us and be a part of our community. It's growing hourly and it's rather validating. I love all of my subscribers because you all come out of the woodwork sometimes in some videos and you have great things to share and you support each other. You offer resources, you share your own experiences, and that's what I love about this YouTube channel. So thank you so much for that. If you're new, I encourage you to stick around. I think you'll like it. If you don't know who I am, let me go ahead and introduce myself. My name is Tamara, and I'm an internationally and board certified trauma therapist and a licensed therapist. I work primarily with children's, teens, and families, but also adults who are dealing with trauma, loss, and grief. So you're going to get a lot, but everything I talk about has a foundation of trauma. Let's go ahead and jump into this new topic on the channel. So when you hear the word bipolar spectrum disorder, I'm sure you're like, what? When did that come about? Well, the DSM-5, which is this book right over here, it basically created dimensional diagnoses. And what I mean by that is that they are constantly changing, that we can't just put an individual in a particular category and say, okay, you belong in this category. We have to have a spectrum of symptoms that an individual can be defined across or can fit into based on their symptoms, right? We can't just say, okay, you have bipolar. Okay, you have autism. Okay, you have anxiety, depression. Because if we do that, right, we're missing the mark. We're not identifying that particular individual's symptoms. We're not identifying their way of expressing themselves. We're not identifying the way that their particular symptoms are being expressed. We're putting them into a category and we're saying, okay, you have this. We're not doing anything other than that. So I think it's important to view mental illness on a spectrum. I do it all the time. I explained, I think it was in this video right up here, ADHD, and I said ADHD is at the one end of the spectrum, oppositional defiant, conduct disorder, and then sociopaths, right, or antisocial personality disorder. So that's a spectrum. Well, the same thing happens with bipolar spectrum. And you're gonna find these particular things right here on the bipolar spectrum. And there's a reason for that. And as we go along, you'll find out. But the spectrum makes it a little easier to categorize people and identify them. So that's the most important part of all of this. So let's go ahead and jump into this, okay? So we have bipolar 1. Bipolar 1 is characterized by mania, which is an elevation of mood. It's an elevation of mood. It's euphoria. It's like feeling like you're getting ready to get married and you're excited and you can't sleep and you have all these butterflies and you're like nervous and anxious but then excited at the same time and expectant. You have this energy. You may even feel supernatural or powerful or grandiose, right? You have all these wonderful ideas of family and love, and that's how an individual with mania can sometimes feel, but they're like that all the time. It's not just for getting married. It's all the time. We also have individuals who, when they're manic, they're pretty risky and irritable. So you may not get that individual who's elevated in mood and pleasant and wonderful. You may get that individual who's hyper, cannot sleep. They don't feel they need to sleep. They can go days without sleep and they look like they've been asleep, right? There are some individuals who are manic and they can stay up for 4 days and still look like they can keep going. And that's what makes it a disorder, because the energy level is so abnormal. So, they can be manic, but they can also be very irritable and manic. They can also be very aggressive and manic. They can also be the manic individuals who have a really hard time with traffic, right? They're the ones blowing and screaming and yelling and cursing and slamming things and, threatening other people on the road, right? Those individuals can sometimes fit into the category of manic individuals, and they're the irritable kind. So, I like to explain to my clients that you may get manic individuals on this part of the spectrum that are really nice and happy, and you may get individuals on this part of the spectrum who are really irritable and aggressive, and they don't know how to control their behavior. And so that's part of the bipolar spectrum, right? When they are manic. But then you also have individuals who are depressed, and those individuals can't get out of bed. They don't want to get out of bed. They can't. They are very, very depressed. They don't know how to function in daily life. They don't want to, right? They have a low level of motivation. They also may be irritable, and they may have a short fuse. And these may be individuals who also struggle with sleep. They have insomnia, not because they're manic, but because they have too much on their mind. They're worrying, they're ruminating. Here's the definition of ruminating, right? They sometimes can't sleep because of that. Sometimes they can't sleep because they just have no peace on the inside. They just feel unsettled or restless, So that's the depressed side. Now, we can sometimes have both at the same time. We can have the mania and we can have the depression. And sometimes it seems to hit at the same time. And that is known as mixed bipolar. And that is when the individual, again, has both things at the same time. 1 minute they're manic, next minute they're not. 1 minute they're depressed and sulking and have low motivation and they're experiencing what's called anhedonia, and other times they are not. And so these individuals can be confusing, because sometimes you may start to think maybe you're on drugs. Like, why are you this way 1 minute and this way the next day? And that's just the characteristics of mixed bipolar, okay? And that's usually how that goes. Now, the word bipolar helps you understand what the definition of it is, okay? So the word bipolar actually means poles, and you're swinging between two poles. And so people who have bipolar disorder, they swing between two poles, manic and depressed. And those two poles that they swing between can really destabilize their life. It can also destabilize, as I'm sure you're well aware of, their relationships. And if it's a parent, you've got a major issue there, because sometimes the parent's depressed and can't get out of bed, and they're substance abusers, or they're sleeping around, or they're doing things to try to make themselves feel happy or better, and the child suffers and gets neglected. Then you have parents on this side of the spectrum where they are so manic that they drive too fast. They have way too much excitement in their life. They're partying every night. They're getting drunk every night. And the child goes neglected as well. So whichever spectrum, whatever side of the spectrum you're on, sometimes either side can be a detriment to your well-being as a child growing up under these individuals. The traumatic part of this is that the individual has a variety of symptoms that can destabilize you. One, and we're going to talk about the manic symptoms, then we'll talk about the depression symptoms. But one manic symptom that can destabilize you growing up under a parent like this or an individual would be their overactivity and their delusional state. Sometimes individuals with bipolar disorder can be very, very delusional. They can also be very manic, very hypomanic, meaning that hypomania means that they're really not that risky. They're not really that high and elevated in mood, but they're still abnormal in how they react to life. Then you can also have the individual who's, of course, manic, where they're constantly hyper, they're constantly seeking excitement, they're pleasure seeking, they destabilize the environment, and they can make it a very traumatic environment because of that. I had a kiddo that I was counseling last year, and this poor kiddo had a dad who was manic for a long time. Like, he was manic for a month or two, off and on, because he was playing with drugs, and the marijuana and the meth just had him like this, up and down, up and down, up and down, up and down. And the child really struggled with that. I just wanted to adopt him because he was so cute and sweet and so smart and intelligent, but he could not get his dad to be dad again, and he struggled a lot. He actually started having nightmares and flashbacks, and I ended up diagnosing him with PTSD because he experienced this over a long period of time, his symptoms and his dad fluctuating in his manic states. And the traumatic part of this is when his dad was manic, he would invite prostitutes into their home and he would sleep around. And this poor child would witness that. The sad part about all of this is that this poor young man would hear his dad engaging with the prostitutes, and he would, walk out into the main area and see meth everywhere and see all of this paraphernalia everywhere. And it was really hard for him. His dad would also pleasure seek by looking at violent porn. And so, his poor dad was sinking in mania and creating a very traumatic life for his son. So I ended up diagnosing this poor kiddo with PTSD just because, he just couldn't sleep at night, had nightmares. And so for you, if you had a parent who was manic all of the time, or when they were manic did really risky things, you know what I'm talking about. There's some other symptoms that can really be traumatic for kids growing up under these kind of parents. Hallucinations can sometimes happen with individuals who are really struggling with mania. They may think they're hearing and seeing things that aren't there. And if they're teetering around with drugs, they can sometimes feel things on their body that's not there. They can have sensory experiences that are not real. I had one guy that said, he felt like he was walking on air, and he was the uncle to one of my clients, and he would come in and say, I just feel so good today. I feel like I'm walking on air. I feel like I'm literally in the sky walking. And I thought he was being facetious, and he was actually hallucinating. He really believed that this is something he could do. So he was a really, really unstable dad, and a very unstable uncle, these two guys I'm telling you about. So, mania can be very traumatizing. Now, depression and bipolar can also be very traumatizing for an individual, a child growing up under a parent like this. The depression that you're witnessing in this parent can be apathy, right? So you're indifferent. You have no emotions either way. You're more at an average place. We also have what's called anhedonia. I mentioned that earlier. I'm not experiencing pleasure in the things that I used to. So you kind of check out. You check out of life. Low motivation, you may stay in bed or lock yourself in a room. Sometimes kids may also overhear their parents crying and struggling. And there's also like an emotional crash. So once the individual is really manic, they hit the ground and they crash, and that individual will often withdraw and isolate. And the child is aware of that, and this can happen, through different areas of life, or happen over a series of times in life is what I'm trying to say. It can happen over many, many years. It just doesn't happen in one time and it goes away. This is a constant thing that the child is witnessing, and that's why it becomes traumatic. It's repeated, and it's something that the child is not prepared to deal with, and so they can't understand why the parent is doing all of these things. Usually I like to refer to a person who comes down from a manic episode, hits the ground, and is depressed. I like to consider that an emotional hangover. It's like, your emotions were so high and now you're going to crash and hit the ground, and it's not a healthy place to be. So it's an emotional hangover. So I want to talk about some of the things, guys, that emerges in these kind of parents, the abusive and traumatic nature of these parents. So let's go ahead and just jump right into that. Abusive and traumatic nature of parents who are manic. Here are some of the things that I have seen and research has suggested happens when unusual behaviors and unhealthy behaviors are emerging in these particular parents. All right, so let me explain really quickly what's going on here. So usually the emergence of strange or unhealthy or traumatic behaviors that our child is witnessing growing up, it tends to happen when two things happen. When the illness is getting out of control and there is no treatment, or the person has refused to have treatment, right? Some people with bipolar disorder feel that they don't need treatment, and so they avoid it altogether, right? So the illness is getting worse. And the second is a stressor, and I talked about that in this video up here with personality disorders. Stressors really are an important component to mental illness in many cases, okay? Stressors usually make things 10 times worse. So if you have an individual who has an untreated bipolar disorder, or it's a poorly treated bipolar disorder, or they're refusing help, and then you have a stressor as well, or you have either or happening, right? The refusal of treatment, or the poor treatment, or the no treatment, or the stressor that hits. Either way you flip the coin, unusual behaviors and negative behaviors can emerge. So let's jump into that. Okay, so the number one thing that I have seen is the mommy dearest disposition. The mommy dearest disposition. What I mean by that, guys, is that this kind of a parent is mean, they are cruel, they are angry, they are chaotic, they are emotionally unstable, they are labile in their moods and in their emotions. You don't know which emotion to believe. They seem very histrionic, very shallow, and they also seem very wrapped up in making other people see them a different way, right? So they put out a certain image, but they don't show the love and affection to the child in the home that they should. Okay, so that was a lot, guys. So I'm going to list everything I said right over here. And that is the mommy dearest disposition I've seen. That's one thing that emerges in these particular parents, because they're unhealthy and they need help, but usually don't think that they do. All right. The next thing that I see is alcoholism and drug abuse. Usually these kind of parents will not go towards drugs, but they will do alcohol, and they will engage in drinking alcohol so many times during the week. These are the kind of parents that are drunk at 11 a.m. These are the kind of parents that are drunk at 12 o'clock in the afternoon, at 12 a.m. in the morning, at 7 p.m. at night, right? They have no structure. They have no appropriate adult-like regulation of their behaviors, of their needs, of their wants. And so they want alcohol, they get it. And it doesn't matter what time of the day it is, they're going to get what they want. All right. The other thing too is manipulation and narcissism. Manipulation and narcissism. These kind of parents manipulate to get their way. If they're manic, then they're also going to manipulate to get their way, right? Because they want sex, or they want money, or they want to gamble, or they want drugs, right? So if they're manic and they have this energy and this internal need to get what they want, right? Then you've got an individual who, is a manipulator and a narcissist. They're going to do what they can to get what they want. So this is another set of characteristics that, these kind of parents show. Okay. The next thing, guys, is the lack of empathy. These particular parents just don't have empathy. And if they do, it's hidden or it's internalized. They want what they want. They're manic or they're depressed, and they need to seek whatever they need to seek to make themselves feel good. And if that means the child has to go over there and sit back and not say anything, or has to sit over in the corner and cry while they shoot up, they'll do it. Or if they're overhearing dad being sexual with a prostitute, whatever the case may be. And I've had cases like this in the past. Whatever the case may be, guys, it's going to happen because these parents have a bipolar disorder that's not being treated. A stressor has hit. There they go. And they're not getting the proper treatment, or they don't care to, So this is another set of characteristics, a lack of empathy. The next thing, guys, that I have seen is fluctuations in mood and mental states. 1 minute they're nice, next minute they're not. 1 minute they're emotional and compassionate, next minute they're cold and irritable. The moods fluctuate. They're labile. Okay. The next thing that I've seen is no insight. So they have no insight into their behaviors, and they don't care to build it. They don't want to see how bad off they are. So they continue to do the things that they want to do, and they're going to stay that way. And it doesn't matter who it hurts. It doesn't matter, who's, crying about it or wants it to change. They're going to stay that way. They have absolutely no insight. Okay. You're also going to see some pathological lying as well in these particular parents. They're never going to tell you the truth. They don't feel that you need to know the truth. And half the time they don't know the truth. And other times, they've buried the truth. So, they're going to lie. So that's another characteristic. There's also non-bizarre delusions with these kind of parents. They're not saying that that they believe the IRA or the government is coming after them, but they're saying things like, someone put something in my drink. Or I was at a party the other day and someone tried to put something in my drink, a date rape drug, right? So their delusions are non-bizarre. They sound sensible and they could come across as very competent, but they are not. You have to have a clinical eye, and you have to be able to spend a long period of time with them to be able to determine something's really off here, So these kind of parents have non-bizarre delusions. They also have religious obsessions, Not all, but some. And their religious obsessions tend to be of the nature, I messed up, so I'm going to go to church and read my Bible 9 hours. Or I'm going to go to church and I'm going to confess. I'm going to go to confession every Sunday, every Monday, every Wednesday. And they may stay that way for a certain duration of time, and then it falls off, right? They can't keep it going. They do something else, and then they feel like they have to repent. They do another thing, they feel like they have to repent again. So they have these religious obsessions that leads them to compulsive behavior, this repetitive behavior to try to reduce the anxiety that they have done something wrong. And a lot of times, these particular parents know they've done something wrong. They just can't fix it, or they don't want to look at it. but they have a certain level of consciousness that tells them you've done something wrong. I also want to add in here agitation and irritability. These particular parents tend to be agitated and irritable most of the time. They're not the patient parents that you get tucking you in at night, reading you a story and telling you that they love you. They're irritable. They scream at you and tell you to go to bed. They slam the door and go to bed themselves, and you're just left on your own. Like, these particular parents create a very, very traumatic environment for the child. And that's what makes a bipolar spectrum disorder that's poorly treated, not treated, or the individual refuses treatment. That's what makes it difficult and traumatic. You're not getting all of the parent. You're getting parts of the parent. And you might be getting a mommy dearest parent as well, and either dad or mom. It could be either gender. So this is a lot, guys. You know, these kind of parents need a lot of help, and some individuals can be diagnosed with bipolar disorder and a personality disorder. So keep in mind, the bipolar disorder may not explain the borderline personality traits that you're seeing, or the narcissistic traits that you're seeing, or the histrionic behavior. So it can get really complicated, guys. I think it's important to keep that in mind. Okay, my parent had bipolar, but they also may have borderline personality, and that complicates the picture. So thank you so much for coming back to my channel, guys. Go ahead and hit that subscribe button if you want to stick around. I encourage you to hit the thumbs up button as well if you would. See you in the next video. Bye-bye.